The meeting is being recorded on Zoom, and if anybody is recording on their own volition, they need to let us know now. All right, thank you. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, and the governor's March 15th order imposing strict limitations on the number of people that may gather in one place, this meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found on the Office of the Attorney General's webpage. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting, a listing of topics that the chair reasonably anticipates will be discussed at the meeting. Okay, minutes of last meeting. Sue?
Yeah, there's a few typos and stuff, but I'm not even gonna bother, Jessica. They're excellent minutes.
Thank you.
Jean?
Jessica, did you correct that little issue that we talked about before?
Yes, I did.
Okay.
Yeah, I take a motion to approve the minutes as corrected.
I'll make a motion to approve the minutes.
Second, all in favor? Sue?
Yes, all in favor, Sue.
Jean?
Yes.
Jerry, yes. Okay. Public comment, 10 minutes or as much as the chair wishes to indulge people. Peter, anything you'd like to ask us now?
Will you guys be talking about the decision by the school committee to suspend the fall sports for at least till spring?
Tammy might address that, but it's my understanding that the Board of Health doesn't have any say in the school committee's decisions. Tammy, is that right?
I've given my support, but you're correct.
Okay, Peter?
All right, that's all I got for you guys.
Okay. Oh, hi, Kate.
Hi, how are you, Jerry?
Good, how are you?
I'm great.
How's Robert?
He's excellent.
Can you give him my best, please? Hello.
I will. I'll give him a
How are
big
you?
kiss.
Doug, Joe. Nice to see everybody. Okay, is that it for public comment? Anybody? Kate, public comment? Okay, Tammy, how about your report?
Okay. So let's see. I witnessed, two soil evaluations one at 275 Granville Road, one at 100 South Loomis. Actually, I think I'm missing one at 115 Fred Jackson. I think I'm missing that. We just had somebody enter the room, and I believe, I don't know where the person went.
Right here. Could you?
Is this person gonna be muted?
Where are they?
Dira Yoga.
I think it's Michael from Dira Yoga, maybe. But we'll just need him to introduce introduce himself.
Could you introduce yourself, please? Derek, can you hear me?
I think it's Michael from Dira Yoga, maybe.
Oh, I got it.
Could you introduce yourself?
Michael, can you hear us? Okay, when Michael gets on, we'll get to him. All right, go ahead, Tammy.
So what do I put him back in the waiting room? What do I do if he's not going to introduce?
Let him listen to the meeting, and if I have him as unmuted, but
okay.
I don't know where he is. So let's just continue until he speaks up.
Okay, I just want to make sure that Jess can put it in the minutes who's in attendance.
Well,
And since it's public comment, it's now or never, right?
No, that's not true. Like,
No? Okay.
Chair has
I just want to
something
make sure.
Okay. Go ahead, Tim.
Okay, so final septic inspections at 25 Woodside Circle, 94/96 North Lake, 7 Overlook, 14 North Lake, 9 Noble Steed, and 12 Deer Run. Septic plans were approved for 14 North Lake and 325 College Highway. I did pre-operational food service inspections for a new food truck, Cinnamon Bun Saloon. They are right outside of Coward Farm this week, and they'll be here through Christmas. And I did another follow-up pre-operational inspection at the Brass Rail. I'm still dealing with a housing complaint at 5 Feeding Hills Road. The complaint issues range from broken porch railings through holes in the walls and problems with the faucets, amongst other things.
Is it a tenant landlord thing?
Yes.
Okay.
Yes, tenant landlord. I've issued a code enforcement complaint for 138 Point Grove. Just unsecure property and miscellaneous furniture and debris in the yard. Issued another notice to correct to Wayfinders for Aaron Circle for a smoking issue that they haven't corrected yet. Let's see, occupational safety wise, I'm working with the custodians and maintenance on developing a chemical storage policy for the building and also a lifting and back support policy for the workers. We had a quarterly department head meeting last week. I also had the Hampden County Health Coalition meeting this morning. So that is it for oh no, that's not it for non-COVID. Also, let's see, I had my, let's see. So for this week in, let's see, in Massachusetts, there have been 3 human cases of Tripoli and 3 human cases of West Nile virus. And let's see, in Hampden County.
Oh, I'm sorry, Sam. I'm sorry.
I had them in a specific email, but it's not in this one that I
where'd you go?
printed. But it was in, I think, Eastern Hampden County is, I think, how they put
Yummy?
the last one. Yeah, can you hear us? Or okay.
I couldn't
Kate,
for
you
a
have
second.
information?
Let's see. Hold on. Let's see. I can't. I'm just I just need to do something with the. I'll tell you. Using one platform to do Zoom over another, you have to learn a little different. Oh, the other.
Are those
the other-
recorded, Kate?
The other person that is here is she's representing Dear Yoga, Sophia.
Hi, can you hear me? I'm Sophia.
Oh, yeah.
Can you hear me? I'm
Thank
sorry.
you.
I had a lot of trouble with the mic, and Michael couldn't be here tonight. He asked me to sit in, but I don't know if that would be permissible to you. If you don't want me in the meeting, he can just follow up with you.
No, it's okay, Sophia. We've gone by our public comment, but is there anything you'd like to comment on?
No, I actually just, he just said, please go to this. Let me know if there's something important I need to do or know. So.
Well, you're free to stay, but I will say that there is nothing really new
Okay.
in regards to how the facilities operates. At least not today. I mean,
Okay.
you never know what happens on Fridays. That seems to be the day the governor likes to do new information, but I don't have anything new that would affect you.
Okay.
But you can always, I think I might have Michael's email.
Yeah.
You can always feel free if you want the latest fitness center and other guidelines. I can always send it
Okay.
to you guys.
Okay. Okay. So I'll just go let you guys do your thing. I'm kind of new. I feel like I'm an interloper.
You're
So
not.
I'll just let you go. I'll leave the meeting and I'll let Michael know he can that you can email him or he email you.
Absolutely. Yeah.
Okay.
So nothing new to report on my end.
Okay.
But I will keep you guys
Okay.
posted.
Thank you very much. Take care.
No,
Bye-bye.
no
Okay.
problem.
Okay, Tammy.
Yeah, they've been doing a really nice job doing an outdoor social distance class in front of what's the coffee place?
Daily
The
grind.
Daily Grind.
yeah.
The Daily
Mhm.
Grind. That's it.
Yeah,
Good job.
I see them out there. That's great.
Okay, so we'll jump into our COVID reporting.
No, wait, no,
no,
the West
no.
Nile, what towns are those in? The West Nile and the EE?
The last report was given to me as Eastern Hampden County.
They don't tell you the town? Does Kate, do you get that
No.
information?
It was not it was not Southwick.
Oh,
Tammy, are these fatal cases or just gone checked?
They're just reported to us as positive cases. But we're now really, like, this is the season, so it's to be expected. Although I think we did get some a little bit prior to, there was a triple E prior to the season beginning.
Season end when the first frost, is that basically it?
Yeah, when the frost hits,
Okay,
the
and
first killing frost.
how many were there last year? Do we have a number? Do you remember?
I
offhand?
I have no
don't.
idea.
I don't
Okay.
remember. I'll have to look at the they do an end of season report every year.
Okay, just
Yeah.
curious. That's all.
Yeah, I'll take a look for you guys for the next meeting.
Can I
Let's see.
ask a quick question? Which of the two was reported in Eastern Hampton County?
I believe it was. I wish I had the correct email on me. This was just the numbers. I believe that the first one might have been Hampden County, the second one might have been maybe somewhere out east, and I think the third one might also have been Hampden County, but I could be wrong now.
Oh, so this.
Triple E?
This is just directly off of the state's website, but I get a weekly email too that has more information, but I just printed off the information from the state's website.
Are there 3 cases each of those in the state, or is there?
There are 3 West Nile virus cases and 3 triple E cases, human cases,
Gotcha. Okay.
out of 145 humans specimens. That sounds horrible the way that's written. In that, so far, no positive horses.
I would think that would be in Mavenham. I don't know. I'd have to look.
Yeah, they do a good page on the arbovirus surveillance program page. They put all of the details because there's a I think you can actually go from area to area and click on it to look at the latest information. You can even find that there's been no dengue fever or chikungunya virus.
Oh, thank God.
I don't even know what that one is.
No Zika.
No Zika. Yes, I think the Zika period it came and went. Although they still talk about trying to prevent the spread of it. Okay, so I'll go on to COVID.
No, one
So-
more question, Tammy.
Okay.
The letters you send out for violations for the housing,
Uh-huh.
and then do you follow up after the time period?
I do, yes. And in the case of this one, they were not able to access the apartment, and by the time, so we are setting up a second date to re-inspect.
Okay.
It was Wilbraham, by the way.
Wilbraham, okay. Thank you.
Excuse me.
For which,
Hi.
Triple E or West Nile?
I'm looking at just a Triple E map, so at least that one. There's no
Should I
West
keep-
Nile in Western Mass.
Should I keep going or?
Yeah,
Okay.
go Tammy.
So the,
Go, Tam.
the state amended the travel advisory on the 29th to add Colorado, Delaware, Pennsylvania, and West Virginia. So to the lower risk states. So those are the states that you don't need to go through the travel order and sign up, and you don't have to quarantine or take a test. And so that puts it to the states that are of lower risk are Colorado, Connecticut, Delaware, Maine, New Hampshire, New Jersey, New York, Pennsylvania, Vermont, and West Virginia. We've been, I've been keeping kind of tabs on everything through the state, through the interagency office meetings, which are twice a week, which has been good. They just kind of been giving us the latest information. And that once a week after the state puts out the average daily incidence rate by town, we've been having a meeting with the Southwick Tullen Granville Regional School District. So that would be the members from the school and Kate and myself. Just to discuss just staying on top of everything with the openings. Today we did discuss, and maybe Kate can talk a little bit more about it too. We did discuss how Southwick has moved from the gray area to the yellow area. And maybe, Kate, do you want to kind of give your report right now?
Sure, if that's okay.
Yeah.
I have a lot of concerns about the state dashboard, quite frankly. And I know the schools are very concerned that we went from a gray to a yellow. And we talked a lot about that because once they go into red, then there's a whole, implementation plan for the schools. But let me just give you an example of what I see on a day-to-day basis and some discrepancies, which,
Okay, what puts you from a
help understand.
one course
has a lot of
what puts you from one color to the
What's
next?
that?
I'm sorry, Kate, what puts you from one color to the next color? The positivity rate?
It's about it's about the number of cases per 100,000. So, and they look at the last 14. So gray is less than 5 reported cases, 14 days. Then it goes green, less than 4, yellow, 4 to 8, and then red is more than 8. So it's by the more positives you have, the higher the level.
So, okay.
So if you look at it from gray, yellow, green, red, last couple of weeks or the last week we're in the gray. So right now the state has us at 64 confirmed cases, which is not accurate. We actually have 73 in the town, which is
That's
current
up from
as
2
of
weeks ago,
today.
from 69?
Pardon me?
That's up from 69 from 2 weeks ago, is that correct?
I think so. I think it was 69 2 weeks ago and then 72 last week.
What it was last week. It must have been, positive cases. So let me give you the month of August, for example, to compare it. So for the month of August, we had 549 residents tested. Okay. There were only 5 positive in the whole month of August. So when I see a total positive test for the last 14 days that says 7, there's no way that can be true because we've only had 5 positives in the month of August. So there is, I know there's a lag time. I know there's changes with people like they moved from Mass to Connecticut, or maybe they, you know, they're in Westfield now, et cetera. But to educate people, to let them know that this is what I see on my end when I get case reports and I talk to residents, which is a little concerning. And when I've asked the state about the metrics, they can't explain it.
So I guess our concern would be if that 5 on your end goes to,
Sorry.
3 cases goes to 5 cases, goes to 10 cases within 2 weeks. I guess that's, then we would have a concern. Is that, am I correct on that? It's the
They're
trend
doing
and,
well, they're looking at 100,000 out of per 100,000, the incidence rate. So the incidence rate is around new cases per 100,000. So they have to proportion that around because we're less than 50,000 people per population based. So it gets very complex around the formula. But for example, let me just give you an example. So in August, we had 2 people that went to Rhode Island. They were contact cases, no information. They were not tested. There was no phone number. There was no date of birth. There was no address. So I had nothing to go by. 2 other cases went to New York and were tested positive. So in terms of Rhode Island being a red state currently, and New York being a white state, to me, if 2 of our residents go to another state and they get infected, obviously that concerns me. And I, you know, try to talk to people about, you know, don't travel, please. And again, we're going into a holiday weekend. And that could bump us up in a very ugly way. So we have to remain diligent in every communication that we have. Any questions for me?
What was the exact number of cases? 73 or 72 now?
No, we have currently 73
73. Okay.
as of the 30th of August. Nothing for September.
Okay. Thank you.
Yep. you're
How
welcome.
many cases do we have currently in isolation?
Active? So we have 4 currently. 2 will come off tomorrow. 1 will come off on the 10th, and 1 will come off on the 14th.
Kate, those new cases that we have, any idea what the source was, where they picked it up?
Well, the two of them that will come off tomorrow got it in New York.
Okay,
I have no idea about the one that comes off on the 10th. The one from the 14th went to Noble and was tested, has no idea where he got it because his wife tested the next day negative. So there are false positives out there. But I still put them in isolation. In terms of, you know, I can't, you know, tell you if it's a false positive. I'm not a lab person or an epidemiologist. So, when I talk to the husband and wife, I say, stay in isolation. It's the best way to protect yourselves and other people in the community.
If they're positive.
So
can they
it
come back
just
and-
seems odd.
Kate, if they're positive, if they're positive and they don't have any symptoms and the wife and the other household members are
Yeah,
negative, can they
there
go
was
back
no
and get a
symptom.
test like in a day or two, or they have to get permission? How's that work?
No, he is actually going to get tested at the end of his isolation period.
Okay,
His wife is very adamant to take him on the 15th
okay, fine.
and go get retested. Yep.
Right.
And he
Yeah,
had
yeah.
3 negatives before that because he went into a nursing home.
So Peter, you all set
So
with that?
it's, yeah, any questions for me?
I'm all set. That's all I need.
Okay.
Okay.
So I have a question. We have a motocross this weekend. Is that right, Joe?
Yes.
Okay. So that's our little rallying point there for concern, I think. Who's patrolling that? How are we going to make sure that we social distance and masked? And who's going to be responsible for making sure we don't turn into a Sturgis or a mini Sturgis? Tammy?
Okay, so I had a conversation, an in-depth conversation with the organizer there, Rick Johnson. He already has a very extensive plan on, on all of those things, but I felt that we could probably make it a little bit, a little tougher. So he's flagged some areas that there were more people congregating and that he had to talk about, social distancing and masking from the last experience. So he's going to add additional, he calls them flaggers in those areas, just to make sure that the racers are, corresponding to all the policies that they have in place.
So what's the meet? Is it a meet, Joe? Is it what's the occasion? Is it open? What's this motocross going to be?
It's an actual race. They believe it was scheduled for New York and New Hampshire, and they could not get the staffing to do it. So with permission, they moved it down here. Every race that he has, he's done extremely well. I know there was some issues at the last one with some people a little too close together. I believe it
A
was
lot of
corrected.
issues last time, Joe.
What's that?
Place was packed.
Yeah, it's going to be packed, but if you slow down and take a look around, it's working. He has some issues with a few extra people that shouldn't have been maybe next to each other, and he cleaned that mess up rather quickly.
Okay.
But yeah, it is packed, and it's packed 20 feet apart, and he's doing a hell of a job considering the circumstances. And I agree, it is nervous, and you don't want anyone to get have any health issues, of course. No one's trying to have that happen, but yes, when you pull in, and if you haven't been to a race, you go, holy shit, what is going on here? I agree.
Yeah.
But we're doing our best over there, and I think realistically, it's working. You don't see any spikes in cases. We've had quite a few events over there, yeah, it is a little busy.
So sometimes it's better to be lucky than good, but my concern is that one day the dam may break, and I'm concerned I'm sorry, who's running this over here, Tammy?
Say it again.
Who's running the show over at Motocross?
Well, it's an organization, that's
Who's
the
in
WIC.
charge?
But Rick and Kevin Johnson, is it?
So my question is, are they tough enough to say, hey, we got too many people in here, you can't come in?
Absolutely.
Oh, I
Okay.
completely agree. And
Fine.
every Monday or Tuesday, I usually get a report with either photographs or videos.
What's nice there is you just can't show up and come in. Everyone is pre-registered, prepaid, so there's no money changing hands. There's very little touchy-feely kind of thing going on. So if you called that gentleman, Mr. Johnson, Saturday morning for a Sunday race, he could tell you how many people are coming exactly.
Okay.
Can I ask a couple questions? If we can only have 50 people in outdoor gatherings, how can they have more than 50 people?
It's because it's not an event, there's no spectators.
So they're not letting any spectators in.
It's,
No
you're
spect-
only a racer and then you're limited to a pit crew. And that's it, no
We'll
spectators.
watch it. There's some people that go up to Wally Park, but that motocross can't control that. I mean,
So they're going to try to social distance while they're racing.
Well, they're
Well-
social distance by being on bicycles and wearing helmets with masks.
Right.
First of all, they're motorcycles, and they are
So it's
social.
like-
They are social distancing. First, second, and third might be a little tight, but I can promise you the back of the pack is definitely far apart.
And how fast are they driving an hour? How
No,
many
they're-
miles per hour?
That's a great question. I would say all of 60 or 70 miles an hour.
So they
So
have
the-
masks on their face shields?
Yes, they have a full face shield on. Yes.
Okay,
The biggest problem there is broken limbs more than anything else.
And,
Are
and
any
I
of the
think each heat is 25, I think. Is that what it is?
It depends on the
Something
day
like
and which event it is, but more or less it's 25. And the other group doesn't go down till the other group comes up. So there's no hanging around down at the starting line with, group after group after group. It doesn't work that way.
so who gave them permission to move this race from wherever to here?
I believe the other two Board of Selectmen.
Okay, is that right, Doug?
Yes. I believe the event came from, I think it was Maine. And so they asked to add a date to their calendar. Like I said, there's no spectators allowed. It's only competitors and, a very limited crew.
Was Tammy consulted?
Good
Yes.
Thank you.
How many
And it falls under the guidelines that have been put out to the state since phase 2. So
This is like a Red Sox game. There's no
Mhm.
spectators. It's only the competitors. And there's very limited contact, just like baseball.
Mm-hmm.
Well, not quite, but.
Well, there's more room at the track than in Fenway.
And actually, this facility, I would have to
So
say
my
is,
question is anyone taking a sign-in sheet with phone numbers?
absolutely, it's all online. And
So
if
we
you
needed
and if you
support
are
that
if
from
you're
Rick Johnson, we could.
say that again. Oh, Kate froze.
Those.
Okay, we didn't hear that.
Jerry, I'm sorry. Are you
We didn't
asking
hear you.
me?
Yeah, after you asked if there are the contacts, so Tammy said they were
Yeah,
all online.
Right. But I wouldn't see that. So if we said to Rick Johnson, can you pull me a list? If there's a potential cluster, we would be able to get that.
yes, he has every name and
Information.
address and phone number for everyone that's on the grounds there. Yes, absolutely.
Here's my
Okay.
question. 20 people come from Bangor or come from, wherever, and they go back to Bangor and they get tested positive, 2 weeks later. I mean, we don't get notified. I mean, they go down in Maine statistics. Am I right? Unless they say they went to motocross, and unless somebody's smart enough to say, put 2 and 2 together, I mean, we wouldn't know that they came from Southwick. Would we, Tammy?
I hope the Maine Health Department person would contact Mass, i.e. me, and have a conversation about that. That's what states are supposed to do.
Okay.
If there's a concern about where those individuals were, if they can put 1 and 2 and 3 together, right? It depends on where those people live, if they're all in the same community or not in the same. I mean, it really varies, but usually there's an outreach, which I have seen from New York or from Connecticut, that those states would do the same thing.
Joe, are all these racers from Maine?
Nope, just 3. Only 3 from Maine.
Are there any racers that are coming from hot states?
I'm joking. So they're from all over. And I'll give you a quick example. A couple of weeks back when Rhode Island, and I don't, you know me with dates and time, but when Rhode Island had that issue and no one was allowed, they literally made anyone from Rhode Island racing not to come. So they're on top of all that. I'm sorry.
Well, I
That's a
had
hot
told,
state.
yeah, I had called up Rick Johnson and I told them if they can't show up with a negative test that was taken within 72 hours, not to do it, but instead he just excluded them.
Enough?
So they're from New England. Yes.
Well, Rhode Island's New England, isn't it?
Yeah, it's a red state though. It's,
Yeah, I mean, so no red
Not
state.
anymore. I think it came back off the list, right?
okay.
I did not see it's still on the list as of this week. They took Colorado, Delaware, Pennsylvania, and West Virginia off the restricted list.
Yeah, I would be concerned.
Well, you can find out tomorrow, Doug.
Right.
I mean, it's
I
already.
defer to Tammy in all respects to this.
I
Well,
assume that-
at 4:00, I copied the states my thing.
No,
so as of 4:00 today,
I
that's
just thought I had saw it, but no, by all means.
So I assume that the registration is closed, Joe, is that correct?
For this race, I honestly wouldn't know that. That's
Okay.
all. I don't know. But they're doing a hell of a job over there. And Tammy's in contact all the time with them.
Okay. I'm glad it's good. I'm glad it's doing well.
I don't think it's doing well, but it's
Okay.
doing.
How's that? Well,
Today, that's great, right?
well, it's better than not having anything, and I know the lack of spectators has hurt everybody, particularly.
Yeah.
Okay. Tammy, anything else? I mean, Kate, are you done?
Yes, I'm all set.
Tammy?
I'm all set.
So we had 3 cases since the last meeting, is that correct?
When was our last meeting? 2 weeks ago?
Yeah.
Um,
23, or is that 4?
I'm going to
3.
say
Does
3.
Jessica have it in her minutes?
Yeah, 3 and 4.
I believe it was 69 last week.
Okay.
So that,
Or 4?
2.
Hey, Peter, does Joe get his quote in the paper for tomorrow?
No, I failed to take that one down. I apologize.
Okay.
Sorry. Sorry.
Thank you, Peter.
It's okay.
What's going on with that church? Remember we talked about it last meeting?
Oh yeah, so I requested they submit their self certification checklist and their plan for the church. I figured, I mean, honestly, that's the first thing in my mind. I thought to get, I don't know, get things in order. If they can't do that, then if they can't prove that they have a plan in place that's positive, that is up to code, which every business should be able to, including houses of worship. Then we can figure out where to go from there.
So here's my concern.
Wait a minute. When do they have to get that?
Say that again?
When do they have to get that to you?
2 weeks, I get asked.
Well, 2 weeks, and they're gonna meet this Sunday.
And here's my concern. Every time I go by there on a Sunday, there's the parking lot's packed. There's got to be, I don't know, I guess I could count them. There's got to be, I don't know, 150, 200 cars there, and their capacity is what, 180? And I would bet the over under on each car is more than 1. So I don't know how they're doing it, and I think 2 weeks is too long to get a plan from them. So what do you think?
Okay, I'm sorry. That's what I submitted. I asked 14 days on my letter.
How long ago did they get the letter?
I haven't received a certified mail for it yet.
So you may not get certified mail for a week.
You may not get it.
Yeah, they may not pick it
Well,
up.
they get both. They get both. It's been the policy of the department to do one standard mail, one certified mail.
Yeah, that's the legal way to do it. But this has been going on for 6 months. This is not a new issue. And it's the only place in town that I can see constantly, and maybe because it's on the main drag, and maybe because everybody goes by it and sees that lot and shakes their head. So
You're talking about the Baptist church, Jerry?
I am, ma'am.
Well, you know what the state is requesting, actually mandating, correct me if I'm wrong, Tammy, about pre-K through 12th grade with flu shots,
Correct.
except for the medical and religious exemption. So what I would prepare the board for is the same thing with pertussis. They exempted out. We had a major outbreak in pertussis cases from unvaccinated children.
So I guess we have till January 1st for that bridge.
Yeah, December 31st, yep.
And my guess is that, am I right, Tammy, this is a state issue, or is it fall back on us?
It's a school department issue.
Even for the private
I'm assuming
school?
they
I think
have.
it comes from DESE. I think.
Yeah. I'd have to check again.
So
I believe
I
it
don't,
is state.
I don't mean to beat a dead horse. But
But
I think we need
Do
to
we
jump
go
up.
and do, I mean, if a kid didn't get their MMR, the health department would never get involved, right?
I don't know.
Not unless there was an outbreak. So we're in a pandemic with COVID. There's no vaccine. The state is mandating protection for regular flu, which is they're trying to do some type of mitigation. And again, the religious, actually, it comes down to parent refusal is what we heard.
So we're ahead of ourselves with that, Kate, because we have till January 1st to ferret that out.
I just think we need to prepare ourselves
I
for,
know.
that population of people that there could be problems. And I want us, to be thinking about, it doesn't matter on the disease.
Sue, what are your feelings?
Well, what can we do?
Jean?
Same thing. How can you force them? They can claim religious beliefs are preventing them from getting the vaccine, and you can't do anything about it.
This is the mandate to get a flu shot by January 1st is religious exemption in it? Like still?
Yes.
It is.
Yes.
So all I have to say is their religion precludes them from getting the shot. Is that correct?
I don't know this.
Well, I think we should follow it up.
Well, religious or medical. So a parent would have to sign a waiver to that, and that would go to the school. The school nurses would monitor that, just like they do with other vaccines.
Do they have a school at that church?
I don't
Tammy?
know.
I'm only aware of their like Sunday school type activities.
And does the Sunday school fall under, I mean, they need sprinkler systems to have Sunday school, or is it different? How's it, is that a quote school? I mean.
No, it's not. It could be for adults. Sunday school does not necessarily have to be for children.
I get it. Okay.
And I'm using that as one term, but as just
I see what you mean. Okay.
religious
Right, get it.
classes.
Education, yeah.
Yeah. Okay. Sue, anything about what you asked about the church, about their attendance? Would you like the Tammy to do?
Well,
Come on,
Tammy,
Tammy.
Tammy just has to wait and see what their plan is.
They have to submit per the governor's order, so
To who?
if requested,
To you or to the state?
to me,
Okay.
to us.
All right, and if they don't submit, then what do we do?
I guess we'll can decide from there.
What are the options?
Fining, we don't really have a license to hold over them, so I would say we'd have to work with another department. Like, that's the first time I would say I'd ever have to shut down a church, so I would have to research that.
My guess is we'd get a legal opinion at that point. So that's my guess, if I was a betting person. Doug?
Thank you. I have no idea. I don't think we've ever had to close a church before. But Dr. Asia, I agree with you. I mean, I drive by there on Sunday kind of half on purpose. And, you know, I stopped to count, and I stopped counting at 100, right? And it goes all the way behind the back. And, you know, I'm familiar with the operation of the place next door, doing online reservations. And, you know, you got to have a ticket to get in, and they let, like, you know, 11 people in, and that's it. And, you know, whatever. And then, you know, it's not about the number. If they had a building that could cover the number that they want to have, then they could do it. But I think this is, you know, it's a safety issue because it could be impactful to those around, not just those in the church, right? And I think that's the big concern. And so, you know, whether it means that I don't know what's the answer. Maybe we should get a legal opinion anyway. Period. And just so that when you get your answer back or you don't get your answer back, you have your process to follow.
I think that we're basically asking everybody to voluntarily comply, and we don't send out I mean, Tammy doesn't have monitors to go around like other cities do. I mean, this is basically voluntary compliance, and it's the middle of a pandemic, whatever adjective you want to put in front of it. This is the real thing, real deal.
Well, I get it, and I know with everybody in town, you know, the businesses in town for the most part have been extremely cooperative, you know, and have adapted as best they can, or worked with the Board of Health to consult and get advice. And the Board of Health has been great. Tammy's been great about trying to help people safely maneuver through a pandemic.
Yep.
You know, and I think you could certainly count on one hand the number of businesses that she's had to go back to where people were doing stuff kind of, you know, not right, you know, and it probably only took a phone call or a visit once or twice to get everybody on the straight and narrow. So you know, and this is probably just one more. So we just got to deal with it that way.
Go ahead, Joe.
I agree.
I'll gladly go with Tammy and the chief one morning. We'll have a nice sit down with those folks.
Yeah,
You know, and I think that's what it takes. And we'll just spend 20 minutes with them and really hash it out so they completely understand where they're headed.
well,
I think
that's
it would
fine.
go a long way.
Because everybody, I'm getting tired of going around town and people are coming up to me, hey, what about that place?
Yeah, Tammy, we'll go one morning, meet you, we'll grab Chief Bishop, and we'll go say hi. That's the right way to do things.
Well, listen, go in on Sunday.
Yeah.
And see what's going on. I mean, that's what somebody needs to do.
Well, that's the point, right? If you go there any day but Sunday,
Yeah.
you know, Saturday night, Sunday night, it's crazy.
And I get that. I'm pretty good with people, even if it's not full. I'm sure they'll understand completely where I'm coming from.
Okay, I think that a nice talk first before he takes the glove off. Okay, Jean, what do you think?
Tammy, do you think that's a good idea? I do.
Sure.
Sue?
Yeah, I agree.
What is the
What do you
idea?
To have Joe, Tammy, and Chief Bishop go and pay the head guy at that church a little visit and sit down and talk to him for a minute.
You're gonna call him and make an appointment so he's there?
Yeah.
Yeah, I would.
I'll take care of it.
call and make appointment.
Okay.
I'll take it.
Mr.
Yeah.
Beebe's gonna be our liaison, I hear.
Oh, yeah. Not a problem, folks.
Okay, Tammy, you okay with that?
Fantastic.
Okay,
Good, that'll
Fine.
work.
okay.
Three amigos.
Hi, Jessica, you have anything for us?
No,
Kate,
Nope.
anything else you'd like to discuss?
No, I'm I'm happy, but I would also throw out that there are some communities that have decided to follow the CDC with quarantine and isolation. And I think we need to be aware of that as well, that they are foregoing the 14 days.
Oh, I'm sorry. You want to repeat that for me?
They're foregoing the 14 days of isolation or quarantine.
Who is?
Ooh.
Surrounding communities.
Oh.
Oh,
Well.
What does
um,
that mean, Tam? I'm sorry.
That means that the CDC recommended that there does not need to be a 14-day isolation or quarantine for contacts or positive cases. And there are some communities that are going to be following that or are following that.
If they go down to 10 days, is that was it?
No, 0.
0
No,
days.
Yeah.
So if you have a positive case, you just go walk around. Is that what you're telling me?
Well, I think they want to do herd immunity is what I think their CDC is getting at.
No,
Um,
that didn't work.
Why are we pulling punches then? What towns are doing that?
well, I believe Westfield is.
Yes. So,
Joe, we got to take out the bridge.
Done.
the
Done.
herd immunity doesn't work with this thing.
Yeah.
I mean, Sweden tried it, and the whole country tried it. And it
Yeah, it
didn't
started
work.
raining chocolate over there.
I'm just throwing that out that
Okay,
there
well,
are
Anyone
some
else?
communities that are abiding by CDC, not the state.
I guess it's up to the governor to decide what to do. You know,
Okay.
Mm-hmm.
No more Westfield.
Mm-hmm. So, just so you know, it's out there if you hear it, and I don't know why the CDC would decide to do that, but
oh, you don't?
they seem to
Yeah,
think that
You have no hint, huh?
yeah, we won't get into politics.
You won't.
yeah. So who knows what that will bring.
It's
Well,
the same thing
I
with the
agree.
with the
I
plasma.
believe that what we're doing is the right thing, and I would kick and scream,
Well,
to-
it's
to get
listen.
that
It's
out.
basically saying to somebody, listen, this is a pandemic. And I guess you're not going to put a lock on the door and have patrols out there. So, people have to have a moral conscience to decide what to do or not to do. And
I totally get it.
so if 185,000 people dead doesn't bring you a moral conscience, then maybe 250,000 dead will do it for you. At some point, that's what it's going to, and it's going to go to it quick. I mean, even with the vaccine, that's still going to be, the numbers are still going to go up
Right.
to 250, maybe 300. So you figure out herd immunity. There's 300 million people in the country. The death rate's 002. Kate, is that about right?
I don't even know the death rate.
Okay, so let's say it's
offhand.
002. Okay, that's 6 million people. So you pick them out, which 6 million people you want to kill to protect
Yeah,
the rest of the
thank you.
population.
No, thank you.
So that's the theory of herd immunity.
Yep. Yep.
So, if you're lucky.
Yeah,
Okay, I said.
Okay, I just have one more thing. Sue, you mentioned the budget, and I got a copy of it here.
Mhm.
There's not really any expenditures. You got a supply budget that's been encumbered, but not
So
much.
we used to get one every month,
Right.
so it just would be nice to have it.
Okay.
We got it. We did
Started,
get it.
it started in July, August?
Yeah, July.
Yeah.
July for fiscal year.
Do we
Right.
have- Yeah,
Yeah.
do we have a number at the end of the fiscal year on what we pulled in for the year? Tammy, is that available?
I could get it for you.
Would you please, for the next meeting? Because I think it's important. The selectmen went out on a limb. We proved a point for our full-time job. We added extra money to the general fund and not a revolving budget, which was fine. But I think that, we need to make sure that the select board knows what's coming in from us. We need to know. So justify what we're getting in the budget from the town.
Well, we're not expending anything yet.
Well, I just think that the argument we made last year was when we raised our fees, about an X number of thousands of dollars more, we basically funded Tammy's increased costs.
Mm-hmm.
So I'd just like to see the numbers, that's all.
That would be a nice thing to know for sure. I agree. That would be just knowledgeable to
Yeah,
have that.
because if we're not, our fees are still relatively low, but I think we're doing a lot of work in town, and what I hear, is that right, Tammy? I mean, it hasn't been a slowdown in septic and,
No,
Okay.
not at all. I mean, I
Easy.
think we're at, I think this week was a 51, 51 plus 4, so 55 septic permits,
Mm-hmm.
quite a bit.
Yeah.
Repairs?
51 repairs, 4 new.
oh,
Wow.
Yeah, pretty good.
okay.
All right, and then we only have 1,200 left in the COVID budget?
Yes. Yes. And then I believe after that, we go through I think it's a CARES Act.
Oh, the CARES Act. Yeah.
Yeah, I don't have too much details, but the town will get reimbursed through that after that. But this was easier, and it wasn't, it's grant form, not reimbursement, but
I mean, I have to I do the select board here, so my guess is that the Board of Health will get the money it needs, and then they'll worry about where it's gonna come from. Is that right, Doug? Is that pretty much it, within reason?
In reason, I mean, before you go
I
buy
know.
a helicopter or something, you might want to check with somebody, but
yeah.
there's money available under the CARES Act that we can start to look for reimbursement for as part of the disaster declaration under the federal disaster deck.
So Tammy, you wanna cancel that helicopter order? Joe, is that about correct?
It's going to
The-
Bermuda.
The only thing I want to make sure we have money for is Kate's COVID response. Like, that's the top priority.
Just let us worry about the money. You guys are doing a great job.
Exactly.
Keep doing what you're doing, and we'll take care of the other headaches. You guys just keep doing what you're doing.
Okay.
I think that.
That's a deal. Thank you.
Yep,
Thank you
not a
for
problem.
that.
I think that the school is on top of what's going on. I mean, it's a tough decision to cancel sports.
Mhm.
It's one less headache they need to worry about, but I mean, it's gonna be a big thing when school opens up and these kids all get together, and we'll see what happens.
Right.
That's,
And Tammy and I are very supportive of the school committee and the superintendent in terms of their thinking of the greater good and the safety and the health. And you can't predict what will happen when, the kids come back and the faculty. So it's better to err on the side of caution, and then we assess and move from there.
okay. We'll find out when it happens. Stu, anything?
No, nothing more.
Okay, Jean?
No, I'm all set. I'll
Um,
make a motion to adjourn
oh,
the
hold
meeting.
on, in a minute.
Oh,
Peter, anything you
Well-
want-
Let's go.
yeah. Come on, I gotta go put my pajamas on.
Quiet. Peter,
Oh my God. I love
I've-
you guys.
I've got nothing. Thank you, though.
okay. Tammy, anything you need to add?
No,
Okay. Kate, I don't know if she's
No.
gone or not, but,
No, I'm good. I'm here and I'm good.
okay, everybody be safe over the weekend.
Thank you.
I'll get a motion to adjourn.
I'm not doing it again. No.
Okay,
no,
second, all in favor?
Second,
Okay, Jerry, yes.
Jean, yes.
Sue, yes.
Okay, everybody enjoy the holiday.